Hello and welcome to Health Professional Radio. I am your host, Neal Howard. Many of us suffer from IBS, irritable bowel syndrome, and many of us are suffering from inflammatory bowel disease. What are the differences and how are they treated, especially now in this age of emerging technology? Our guest in studio today is John W. Popp. Graduated from Vanderbilt University and completed medical school at Yale. He is now the Director of Medical Affairs with Janssen Biotech. He took that position in 2006, and he continues to have an intense interest in colorectal cancer prevention and has visited Congress on numerous occasions to inform legislators of the importance of preventative strategies. How are you doing today, Dr. Popp?
I'm doing great, Neal. How are you? Thanks for having me.
I'm doing well. Thanks so much for returning with us. Janssen Biotech, the Director of Medical Affairs there, what exactly is Janssen Biotech involved in?
Well, by virtue of the name, Neal, we are a biotechnology company, and we do manufacture biologic drugs, which are different from what we call small molecule drugs. Biologic drugs are actually made from living systems such as microorganisms, plants, animal cells, and they're very large and complex molecules. But our company is dedicated to both immunologic diseases, oncologic diseases, and we've always had a very large presence in the field of inflammatory bowel disease.
Now, in that field, inflammatory bowel disease, Janssen Biotech has developed some technology of their own.
Well, there have been a lot of advances in this disease, and when I say disease, it's actually two diseases, Neal. Inflammatory bowel disease is comprised of both Crohn's disease, which can involve any part of the digestive tract, and ulcerative colitis, which involves the colon. So medications over the past 15 years or so have really improved dramatically with the advent of biologic therapy, and it's really changed the way we manage these individuals. We're also learning more about why this disease occurs in the first place. We don't know the exact cause, but we do feel that there is some dysfunction or dysregulation, if you will, of the immune system, which is very significant in the digestive tract.
Okay. You've been participating in clinical trials since your training, numerous clinical trials evaluating what we call novel therapies for IBD. Are we talking about therapies that were just kind of a shotgun type of experiment, or some things that were more focused around the symptoms and causes of IBD?
Well, hopefully all of our medicines are more focused around the causes. I mean, that's what we want to get to. Although I've told you that we don't know the exact cause, we have a pretty good idea of the chemicals in the body that produce inflammation, and we can actually target those chemicals to stop that cycle and let the bowel heal.
Now, Janssen Biotech has developed a brand new platform. Could you talk about this platform that addresses IBD?
I'd be delighted to, Neal. So we have found in just talking to patients and through various surveys that they really need additional engagement and support so that they can effectively treat themselves and get information to their healthcare provider. And we know we live in a world of apps, don't we, Neal? So there's an app for everything, and Janssen thought, why not an app for our patients, which led to this platform called Gut Check. And it's a way, and it's very easy to download. It's free, obviously. And it's a way for patients to track their symptoms over time. They can collect information. And more importantly, this information can be directly uploaded to their physician. So their physician has an idea of what's going on. Because we have found, Neal, over the years, that patients sometimes don't accurately report their symptoms when they see the doctor, or they may minimize their symptoms. And this really, I think, is a fantastic advance because it gives both the patient and the healthcare provider sort of a real-time look at what's going on. So somebody can see not just one point in time what's happening over, say, a several-week period.
Since there's an app, you download an app for, I guess, longevity to be used on an ongoing basis. Is there a cure for IBD right now?
There's really not a cure. I think some might say for ulcerative colitis, you can cure the disease by removing the colon, but that's somewhat simplistic because other problems can occur. With Crohn's disease, we know that even if you remove part of the bowel, there's a very high likelihood that the disease can come back. That's why, Neal, I think this gut check application is so critical because these individuals generally have disease, well, in the case of Crohn's disease, all of their lives, and it's something they're going to have to deal with. And by having better ways, more efficient ways, more effective ways to communicate with their healthcare provider will lead, we think, to improved care and better outcomes.
And what type of response have you gotten from healthcare professionals and patients using Gut Check as far as any of the kinks or any of the problems that could be improved upon in future versions of the app?
Well, we just launched this app about a month ago. It was on November 11th when we went live. There have already been over 1,400 downloads. We already have 15 gastroenterology practices that are participating. So we think this is a very robust response. And as word gets out, which it will, because I think patients will tell other patients about this, and this is an app we also feel, Neal, that this is what I would call version 101. So we will refine it as time passes. We'll find different things to look at. But already it has the ability to capture a tremendous amount of information and give patients information that they can find very, very useful.
Now, as far as information concerning IBD and this app, what about nutritional information? When someone's at the store, can they use this app to say, enhance their shopping experience when it comes to nutrition?
Well, we certainly have included nutrition as part of this, and we really don't know, Neal, whether there's any specific diet associated with IBD. It's often very personal, and some foodstuffs will bother one individual but not another. But this is certainly some way that they can track their symptoms, they can track their food intake. Neal, this app even has a bathroom finder, which which might sound silly, but when you think about it, if you're a person who has a lot of trouble with frequent bowel movements, and believe it, many of our patients, when they go out, that's one of their major concerns. Where's the next bathroom? Because that's what their life revolves around. And this has a way, it not only has a way to find bathrooms, but it even ranks them and tells about their cleanliness, all kinds of things. So
because I don't have it, and I know when I'm on the road,
probably like to have that.
Oh, yeah.
You might want to download the app. No,
so you say
great.
Over about 1,400 downloads already, huh?
Already, yeah, in about a month. So, and then I think that's going to mushroom. There's also, as part of this app, there's a calendar that's integrated into it, so patients can organize their appointments. They can key into local IBD community events that are going on.
Okay.
There are organizations nationally, especially one called the CCFA, that has chapters in many, many cities. That's sort of a support group, if you will. And I think this will lead to increased awareness in the community of IBD and give our patients a chance to interact with other patients that are similarly affected.
And where can our listeners go to find more information about Gut Check?
They can just download the app, Gut Check. Just search for Gut Check, and it will come up. Download it, install
iPhone App Store, Google Play.
Yep.
Okay. Both of those.
All the usual outlets. Yes,
right.
Absolutely.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been talking with Dr. J. Popp, Director of Medical Affairs at Janssen Biotech, and we've been in studio this afternoon talking about the Gut Check platform. Janssen Biotech has developed this app that is very useful for folks suffering from inflammatory bowel disease. Tips and tricks on how to manage your appointments. There is information on there about where bathrooms are, as well as information about group functions going on in the IBD community. So this app is available through the iPhone App Store or Google Play if you happen to be an Android user. It's been a pleasure talking with you, Dr. Popp.
Neal, you as well. Thank you so much for your time.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to our podcast on iTunes.